Christian Walker, Emergency Preparedness Coordinator with the Hamilton County Health Department, joins us this week. Good morning.
Morning, ma'am.
Bring us up to date on how we're doing in terms of new cases of COVID-19.
We're definitely seeing a surge in new cases here in the county. We had 81 reported cases on Friday. We're still waiting on the numbers from over the weekend to see how things are looking there. But we are also starting to see an increase in hospitalizations as well.
What about testing? I know you guys are doing that there at the department.
Yep. So we've started up testing as well to help augment the other existing testing throughout the county. But we are seeing a considerable increase in the amount of people getting tested as well. Just a few weeks ago, we were only doing about 500 tests a day in the county, and we're back up over 1,300 a day right now.
Oh, goodness. Now, well, then where are we at in terms of vaccinations? Are we getting close to being where we need to be? Are you seeing more people interested in getting the vaccine because of the Delta variant?
Well, we're still leading the state as far as percentage of people vaccinated, and we're over 74% of eligible Hoosiers are vaccinated, or eligible Hamilton County residents are vaccinated. When we adjust that down for age, our number goes down to around 60% or so, 65%, which is still very good, but that's not herd immunity. Herd immunity is 70%. We are seeing a slight increase in the number of people wanting to get their vaccine, which is good. I would probably attribute that to partially, at least, to the Delta variant being out there. I think we're also starting to see some more people getting comfortable with the emergency use authorization, even as we march toward full approval by the FDA.
How are you guys doing out at Colts Camp? I know you've been out there for almost a couple weeks now.
Yeah, so we just finished our second week out there. We've been out there a total of 12 days, and we've done over 150 vaccines, about 13 a day on average. But what we really see is that the Fridays and Saturdays are a popular time to be out at Colts Camp and a convenient time to get a vaccine as well.
Yeah, what are you seeing there? I mean, are we seeing just folks who maybe it's been difficult for them to get scheduled for a vaccine because there haven't been dates and times that work for them? Is this just like, do you think you're seeing so many people because it's just convenient?
I do think it's a matter of convenience. We have seen some folks that come out there strictly to get their vaccine, which is great. We're happy to have them come out. And the other nice thing is the Colts and Grand Park have waived the parking fee. If you go in and say you're here there just to get vaccinated, you get in for free. There's normally a $5 parking charge, but so I do think it does become a matter of convenience. We've seen some college kids getting ready to go back to school out of state, getting their vaccine before they leave, things like that. It's just been a myriad of people, and we think, it's just a big matter of convenience. I'm out there doing something fun, and I can get this knocked out at the same time.
Okay, so we're going to ask you, and you might not be able to say, but have you seen any players getting vaccinated?
Yeah, I don't know that that's something that we can discuss, but nice effort.
You can't fault me. I had to try. Anything else you want people to think about? I know school's getting back in session. Anything we ought to be thinking about in the week ahead as we move forward?
The big thing is school is back in session. We don't know right away when the ages will be lowered for vaccinations for children. We suspect the next round will be 5 to 12-year-olds, which would take that range all the way down to school age kids. We suspect that'll be sometime late fall. But you have to do what's right for your family. I know the school districts are working very hard to safeguard their kids, and they're trying to keep up with the latest trends. But if you're comfortable with your child wearing your mask, by all means, have them wear their mask and encourage them to do that. The other thing is if you're sick, you should be staying home, like we've been saying for years now. We're going to be seeing kids getting cold viruses and other things that we've not seen in the last year because we've all been wearing masks. Please keep the kids home. Just because it's not COVID doesn't mean they can't spread whatever cooties they've got. So that mask wearing, the hand washing, the social distancing, all those things we've been preaching for the last year apply not just to COVID, but the common cold as well. And that's how we're going to help keep our kids in school as long as possible and to keep them from bouncing in and out from quarantine and things like that.
So which begs the question, Chris, because I know a lot of people have been struggling with this typical summertime cold. The Delta variant presents in a little different way than we're used to with COVID. So how do you know the difference between just the summer cold and whether or not you should be tested for COVID?
So it's very subtle, and a lot of folks that have been vaccinated are asymptomatic. They don't even know they're vaccinated. The biggest thing I would recommend is if you have cold-like symptoms, is go get tested. It's the easiest thing to do to at least rule out one cause for your symptoms. And that's where that masking comes in so critical. I've seen a couple reports saying that asymptomatic vaccinated people can possibly transmit the virus, which again goes back to us asking those that are vaccinated to please wear your masks as well. It's anything we can do to safeguard ourselves and others. It's a small price to pay.
All right, Christian Walker, Emergency Preparedness Coordinator with the Hamilton County Health Department. We'll check back with you next week.
Talk to you later, ma'am.